Thank you so much for joining me here today on The Ripple Effect with Ray. We've got Stephen Rouse here, the co-founder of Savva. So excited to have you here and talk all things Savva, what it does. I had some time to play around with the beta this week and just excited to hear more about your story. Thanks for being here.
Thanks for having me, Rachel.
Absolutely. So tell me, Stephen, how, tell me a little bit more about your background. How and why did you get started with this, say, I would say, I don't even know what to call it, but the easiest way, healthcare app utilizing AI technology.
That's a great question. My journey is far from normal, if you would say. It wasn't a big college and a major, and I don't have an MHA or anything like that. I am teamed up with a brilliant person. His name is Amit. He's a brilliant technologist and a globally recognized subject matter expert when it comes to healthcare data interoperability. And we came to pass, I was on a chairlift in Japan after my Christmas light business took a tank years ago. And his founder of a company called Protocol First essentially found me on this chairlift in Japan and hired me to be the head of sales and go to market for the company. And Amit was the co-founder and the CTO of that business. And so ever since then, I've been essentially following his footsteps. I call him my brain. I call him way more than my better half. I am lucky to have a brilliant co-founder. Me, myself, I head of growth. I cold call people for a living. I am active on LinkedIn. I am a talking head, really, when it comes down to it. And he's the zeros and ones. I always make a joke that Amit's connected to the Matrix. He sees the world. When he looks at a wall, I swear he's just seeing green numbers and letters going up and down the screen. But no, in all honesty, I've called myself an entrepreneur for most of my life now. But I was lucky to get the opportunity back in 2017, 2018 to get my feet wet, so to speak, with biotechnology, clinical research, data interoperability, and it's become Savva what it is today over a very tumultuous, rocky, very interesting kind of ebb and flow path to get where we are today, no doubt.
Absolutely. It's no entrepreneurial path is the same. It always takes its own random twists and turns, random synchronicities. You found this somehow you just happen to be on this chairlift with that person. And it's just always so interesting to me as to how we end up in this exact space where we are today. So with Sava, and all that's out there right now. In our pre-show chat, we talked a little bit more about ChatGPT's healthcare function. Now, what's your differentiating factor? Why should people use your app versus, say, everyone already knows ChatGPT?
It's a great question. When the announcement came, I think it was early January, so it's been about 2 months now since GPT Health and Claude Health. They're both released on the same week, essentially. I think the big difference is that both of those big players, while they have hundreds of millions of users, something we don't have, what we do have is direct connectivity to all the EHR systems
Mm.
out there. And when you use one of those big LLM tools, they have no direct connectivity to electronic health record systems. They go through intermediaries and health information exchanges and through different vendors. And so the data ownership through Savva stays in the user's control. And you can feel rest assured that this data is not being sent or processed anywhere or sold anywhere. I think that's the big, first and foremost, the big factor is that we come from the EHR space. My co-founder, Amit, we Protocol First, the last company, was the first fire app, what they call FHIR for those listening, not fire, FIRE, but we were the first fire app used by Epic back in 2017, 2018 to extract patient health information outside of hospital firewalls.
Mm.
And so we've been at this for 10 years now in terms of that direct connectivity. And so that being the first and foremost, and I think the second one would be when you're in Savva, we allow you to choose your AI. If you have to pay $30 a month or maybe $20 a month to Anthropic to use Claude Health versus for us, we created a roundtable inside the app. As you probably saw, you can have Grok analyze all your medical records and your fitness data alongside Gemini, and then send that data to Claude and then to GPT. We let over 17 different AI companies sort of battle it out. And you can test, well, what did Quinn say? What did Falcon say? What did MedGemma say? To have that personalization. From our perspective, we as consumers, we choose our health insurance in this country. We choose our provider. We choose generic versus name brand drugs. Give people the choice when it comes to these second, third, fourth, fifth opinions in these AI models. And
Mhm.
so that's another big differentiating factor for sure.
Absolutely. And what we've come to know is a lot of times these different AI models will spit out different information. What ChatGPT will say, Claude might say something completely, not completely different, but it will give you a different answer. What would you say is, far as when it comes to our healthcare system, the introduction of AI, what are you seeing as far as industry trends?
Consumer health is what we're talking about here. And value-based care, preventative medicine, lifestyle medicine, from my perspective, all starts with access and healthcare democratization to begin with giving people the power to control their own data,
Mm.
right? I think that is the big shift that we're seeing in healthcare as opposed to being reliant on an insurance company or a healthcare organization or on a doctor. People today have these tools to educate themselves. And we're not trying to say we're replacing the existing system, but in between visits, after a diagnosis, perhaps you get a lab test today for something, and the doctor says, I'll see you in 6 weeks. It's a powerful tool for in between that now and 6 weeks from now to make decisions that can better your quality of life, that can maybe let you manage a chronic disease more efficiently. So I would say it's a big shift to consumer-facing healthcare, and it's very exciting. Who knows 10 years from now where we'll be, but the industry will have matured and will have gotten better. And I think it's all tied to, again, lifestyle medicine, preventative health,
Mm.
and all coming back to putting the data in the hands of the consumer as opposed to in the hands of whoever else.
Absolutely. I love that. It's really empowering the consumer in between visits. And I think there's a level of comfort in that too, knowing that there's something outside of just their medical provider helping them navigate some sort of either diagnosis or health struggle, essentially helping them understand it more. I have a question because I have had a chance to play around a little bit, and I think it's only as smart as its knowledge base, essentially. Like it downloads, it pulls the information from your electronic medical records, so it has all of your different labs, your images, surgeries, whatever it might be. But say, for example, somebody struggling with a diagnosis, diabetes, for example, they're asking it, hey, I am struggling with some GI or gut health issues today. Does it navigate or does it strictly just pull from what it knows?
That's a good question, right? From what it knows, the whole idea behind an app like Savva is to connect the dots between multiple EHRs. And so maybe your general practitioner gave you a lab last year for whatever reason, you would need to go on antibiotics and you're not really sure what happened. But maybe 2 years before that, you were in seeing a cardiologist or a specialist of some sort. The problem today is that you can't see all of that data in one place. A longitudinal health record is what people call this, or we like to say universal health record. The ability for what it knows is what's outside that EHR. Maybe you broke your leg skiing in Colorado and your general practitioner in California has no idea. And they're not diagnosing you with that knowledge in the because it's on a completely separate chart. Having all of this data collectively in one place. And so it only knows what it knows. Like I can't fix that to my knowledge, not today. But what we can do is connect the dots between systems that it's not connected to, so it knows more. I guess I'm
Mm,
trying to say.
yeah. No, and it's helpful. I'm asking these as a general person who is very curious about this space and loves knowing more things, right? And so it's interesting to learn a little bit more about what you're creating, which is vast and so important. And I love that it just really it can pull things from just so many different places and have it essentially, yeah, have it as a knowledge base, have it as like a second brain, whereas all these different EHR systems are just, they're separate and they sometimes some of them communicate with one another, but a lot of times they don't. So, what would you say has been maybe working well? What's been a little bit more challenging?
A consumer facing tool, you're at the behest of consumers. It's like starting a restaurant, right? You're starting now you have people and individuals and everyone is different in their own way in terms of what they want to see out of something. And so launching a consumer facing health tool and trying to do it organically without paid media, without ads, without performance marketing and all of this. It's tricky. We're in the first early days. The beta's been live for 2 days now. But I already know for the past year as we've been planning this, it's the go-to-market that is scary, for lack of a better term. How can we, for quote unquote, control the masses and bring this into people's lives and then past that, prove that we show value, right? And so that's the current obstacle that we're experiencing right now is how do we, when we launch this on the app stores a couple months from now, how do we get noticed? How can we get app of the day, app of the week, app of the month, and do all of these things? And our core thesis is price point, right? For $10 a year, you can have access to a tool like this, which is very interesting because we're able to actually price out the leading LLMs. We can let you use these LLMs for a fraction of the price per year. It costs a couple $100 a year to use Claude Health, right? For us, it's $10 a year. You can have access to the same kind of tool. And so it's such a loaded question. I started to sweat when you asked me. It's like, oh my gosh.
Felt it. I saw it.
Yes. Oh man, you sound like my co-founder. This is my side of the business, and it's one of those things where it's like, throw the crap dice and see what happens. Our plan is by talking to people like you and having conversations. Like I said earlier in the call, this is my sixth call of the day. It's 9 o'clock in the morning here in California right now. Doing this organically, it's the only thing we know how to do is having conversations with whoever, with patient advocates, with key opinion leaders from AI and value-based care, and a lot of physicians and one by one, and hopefully by the end here, we've had enough touch points that and the app proves valuable with enough people that we have some oomph when we launch.
Absolutely. And we love organic. I think like when something really hits, I think there's the book like The Tipping Point, right? Malcolm Gladwell.
Yeah.
And like we always wonder what makes something tip, what makes something really take off. ChatGPT was not really a thing a few years ago, right? It was like within the past 2 years, essentially, that it 2, 3 years, I guess you could say, is really when people started learning more about him. They maybe even more so within the past like year or so that people have utilized it more and more. So, why not something like Savva? And just to really highlight and make clear for everyone listening, he said 9.99 a year, not a month, but a year. We pay more for our coffee. We pay more for our Oura Ring membership, 5.99 a month. So it's really this accessibility point that you're giving people. to be able to use a lot of these LLMs, to be able to use something privately as well. I know you mentioned something that like this is as secure as you can get when it comes to your healthcare and your privacy. I just even recently faced a very, I don't know, big HIPAA violation, but basically I got the wrong prescription sent to my house.
Yeah.
Somebody else's prescription landed on my doorstep. So I was trying to, they're like, yeah, this is a huge HIPAA violation, right? So it's just the importance of keeping people's data secure, I think is really a big differentiating factor that you have. And where would you say you hope to be in the next 6 months, 12 months from now?
Part of the app, when you get in there, this, when we set off on this journey 2 years ago, we had a different idea. We, I see, I see places in Southeast Asia, Latin America, Africa, where modern EHRs, probably in my son's lifetime, aren't going to be there. Not at millions of dollars a build. It's never going to come to Dar es Salaam, Tanzania, to take it for example. I went to the hospital in Dar es Salaam one time. Won't get into the specifics, but it was ugly. And what we set off to really do is create a universal patient record. And so in the app today, you might see you go through your health record. That's cool. But what if you don't have an EHR system?
Mm.
What if you're in maybe if you're in rural Montana or even here in Sonoma, my father's cardiologist doesn't have an EHR system, right? It doesn't matter. 6 months to a year from now, Savva will be global because we enable people to upload documents. You can upload a lab test from LabCorp into the app. You can upload an after visit summary from your urgent care visit wherever in the world you are. We have a QR code technology, completely different set of patents called Veer code that's built into the app today for fractions of a penny per patient per year. We can have someone say at Apollo hospitals in India get access to digital health records for the first time in their life with chronological order of after visits, summaries, labs, conditions, medications, prescriptions, all of the things so that they can access the same suite of AI, ask questions, when's my next medication refill? And so a year from now, I mean, I've been saying this for a while. I can get 100 million people on Savva via EHRs in Europe and North America in the foreseeable future. Maybe not a year. That'd be awesome. But a couple years from now, in that same time period, I could get 1 billion, 2 billion, 3 billion people in underserved regions
Mm.
access to this as well. And so that's part of the reason the price point is so low as well. This is trying to be inclusive of everybody. I'm a population health guy. Like healthcare access and democratization is key. And okay, sweet. You're a concierge medicine doctor and you live in Manhattan and you pay thousands of dollars a month. That's great. That's awesome for you, but that doesn't do much for the everyday person. And so a year from now, we're global. EHR is connected in Europe for sure, already underway. Again, we have 314,000 live institutions already. And France and Germany and the NHS in England will go live. But by then, I've got more people than I have connected in EHRs connected via the QR code and in underserved regions. That's why we created this company. My goal is I want to be on the road in Botswana, lighting up continents. That's
Yeah.
the goal of Savva, right? It goes into this whole shift we talked about earlier in the call, consumer driven. You don't, these people, wherever you live in the world, you can have access to something like this. This isn't for North America and Western Europe. This is for the world.
I love that, Stephen. Thank you so much for sharing those insights. And I'm so excited about today's episode. Where and how can people find you right now?
So, thank you. Little quick pitch time. I never
Yes.
do this, I swear. Our website is www.savva.ai, SAVVA.ai. Again, the beta is live, and so if you sign up for the beta, a couple minutes later, you'll receive a link to download the test flight and check this out. patient advocates and people that are managing chronic disease to the front of the line, please. People that are trying to better their health outcomes by understanding it more. And maybe if you're wearing a device, whether it's an Oura Ring or a Whoop or a Garmin or a Fitbit, we connect all of that stuff to your medical records. And find me on LinkedIn or on socials at Savva.ai.
Amazing. Thank you so much, Seaman. It's been such a pleasure. I'd love to have you on again in 6 to 12 months and see where things are at, how things are going. It'll be really interesting to see how all of this unfolds. Thanks for being a part of the ripple effect.
Thanks for having me.